Now am I coming through? Okay. Can't tell from here. I am Ed Yager, informally speaking. I am a clinical professor of psychiatry at the UCSD School of Medicine in San Diego, in California. I have a small private practice, and I think that's enough about me. I want to talk about this subject of migraine headaches. I confess right up front to you, I think the answer to that title question is yes. I believe they are psychogenic. Of course, one needs an explanation for this. The action of smooth muscle in the body, that class of muscle over which we have no conscious control and very little even influence, that class of muscle has the capacity to disrupt all or any of the vital functions of the body. Headaches, migraine, or tension, excuse me, assuming they are not organically generated, headaches are created by the action of smooth muscle, creating pressure, cranial pressure. And this subconscious process that actually does control smooth muscle in highly sophisticated ways is somehow regulated without conscious knowledge, without conscious awareness of the action. We only have conscious awareness of the consequence. In this case, migraine headaches. In other cases, addiction, other pain problems, psychological problems, so forth. You see, I think anyone in this room would agree with me without any hesitation that we are conditioned creatures. We are conditioned by the experiences that we have in life. We have the skills that we have learned, the limitations that we have learned, values, so forth and so on, all acquired in the course of life experience. So it's not really surprising then that along the way we might learn, be conditioned in some limiting or unfortunate way, like experiencing migraine headaches. Well, if that's true, if in fact we are experiencing what we have been conditioned to experience, and that happens to include headaches, the treatment should be, by all that's rational and logical, the treatment should be psychological. It's a psychological problem. Well, of course, the most popular treatment is medication. Does it help? For some people, certainly. For other people, minimally. But it never fixes the problem. It only addresses the symptom. In other words, the migraine headache itself, that's just a symptom. There's reason for it. The problem is that what's causing the headache. Well, how can we deal with this? We can perhaps make life easier, make life a little more comfortable by staying in a dark room, avoiding stimuluses of various kind. They help, but again, it doesn't solve the problem. If we're going to solve the problem, if we're going to actually, literally cure a migraine headache, we must define the cause. Now, I have given a rational explanation for the presence of migraine headaches as being psychogenic, the consequence of life experience. I have given a framework, but the verification of that reality in my world has come from the use of subliminal therapy. This technique, I have been developing it, using it, teaching it for almost 40 years. I have been accumulating data. I'll show you some data here in just a moment. Data that is from my patients. The success rate in treating migraine headache is very high. The treatment time for treating migraine headache is very brief. You see, this technique, I need to describe subliminal therapy in brief form here. There are certain assumptions upon which it's based. The first, most bedrock assumption is that we are conditioned creatures. The second assumption is that this influence that is compelling a behavior, causing the headache, that influence that's carried forward from earlier experience is resident somehow in our minds. Perhaps it's a neurochemical representation, perhaps purely psychic. I don't know the form of that representation, but I do know it's there because the problem is there. The task, then, must be to uncover, to identify, to put that influence in some form where we can identify it and change it. Change it, that is, by reconditioning. That's the upside of this business of conditioning. Dog bites child learns to be afraid of dogs. Well, further life experiences modify that, moderate that, and the child then learns by subsequent experiences that that only applied to that dog, not all dogs. Well, if we have some life experience from which we learn to react by having migraine headaches, the treatment has to be identifying that causal influence and reconditioning it in affirmative ways, supporting present life. This phenomena is fascinating. This phenomena of how we as intelligent, supposedly intelligent, thinking human beings can be afraid of something that's irrational. Phobias. Simple illustration of a conditioned response. Migraine headaches are only another illustration of this phenomena of conditioning. Well, we're going to have to do some reconditioning. It's as though that part of the patient's mind that's causing the migraine headache or whatever problem, that part of the patient's mind is arrested in time, arrested in development. Turns out very consistently that part that's causing the problem, part of the patient's mind that's causing the problem, knows only, today, knows only what that patient knew when that part was created. And these parts, for a lot of problems, turn out to have been created at a very tender age. Of course, we're subject to this kind of conditioning at any age. If we experience some traumatic event where we're truly emotionally traumatized, during that experience, we are superbly suggestible. This is a hypnotic kind of event. And what we perceive at that time, during that intense experience, what we perceive gets internalized and can have long-term impact, long-term influence on our lives, unless it's identified and resolved by reconditioning. Now, the other key assumption of this technique is that we all, everybody, we all have mental capacities way beyond conscious capacities. Well, I think any thinking person would agree with that as a general statement. But with subliminal therapy, we carry it another step. If we have such intellectual capacities that we don't know what we have, it sure would be nice to know we have them and know how to take advantage of them to make the changes we want to make. Well, that's what this technique is all about, exactly that. In speaking of such things, I test the credibility of some people. As a matter of fact, I used to be an engineer. I had a full career as an electrical engineer. During that career, what I'm saying now would have been considered unmitigated nonsense. I was simply not prepared to entertain such thoughts. And I'm satisfied that a few of you out there are having the same experience right now. But if you stop to think about it, think about how limited our conscious ability is to control our own lives. If we're phobic, we're phobic. We can't just not be phobic. If we are emotionally responsive to some trigger, well, we're emotionally responsive to that trigger. We were conditioned that way, and it's beyond our conscious will to change it. On the other hand, by engaging this extra conscious capacity that we all have, by engaging that extra conscious capacity, we can identify the actual cause of problems and resolve them at that level. Well, if you do that, if you fix the cause, the symptom simply ceases to exist. So, how do we do this? Well, if you should decide to learn about this technique and begin to use it in your own practice, you're going to find this scenario to be the theme. First of all, you, the clinician, are filling a role as a guide, nothing more. Well, occasionally there is a little bit more, but certainly not what you were professionally trained to do. Your role in this situation is to teach the patient the skills that are needed and then guide the patient to use those skills. And you, the clinician, are remarkably disassociated, ignorant of the actual work of therapy that the patient accomplishes. Now, that task, that accomplishment task, is done by the patient, but not consciously. All that happens in that higher, extra, special level of intelligence that you guide, you teach, and you don't have to be involved in the content of the work that takes place. Well, now this is kind of odd. That's really pushing the limits. But I'll tell you, I can push those limits even further. Using this technique, I can guide a patient to resolve a presenting problem without my even knowing what the problem is. Well, now I just, as we have the expression in the United States, I just turned on the tilt sign of quite a few people, maybe. How can you, what kind of statement is that? Well, it's literally true. We all have this higher level of ability. One of the first things that has to be accomplished by you, the therapist, is the introduction of the patient to this technique. Well, I do that. I have written a little booklet, I don't know, probably 50 pages, that I give to my patients on the first session. This little booklet introduces them to the concepts and talks about an assortment of issues that typically come up to kind of stimulate the gray matter, stimulate thought about their problem. Typically, the first session consists of, history taking, paperwork, and I, at that first session, ask them to complete a little one-page inventory of the effect of that presenting problem on their life. That inventory, all of the things I'm saying, if you want to research it, is on my website. This little inventory is then completed by the patient before treatment, again after treatment is complete, and hopefully at follow-up. Now, I don't know about in your country, but follow-ups are terribly difficult to obtain in a non-regimented study. I'm going to show you some data. I'm not apologizing for this data, but I acknowledge it is not validated. It's clinical data. It's strictly from my personal practice. And it is data derived from patient-completed inventories, having nothing to do with my biased opinion about whether that worked or didn't work. So, first session, I go through all the paperwork, history, fee agreement, all that stuff. And then I teach almost all of them self-hypnosis. I have found that skill of self-hypnosis can be really valuable for a lot of people. Why do I do that beyond that? Well, I think sometimes it's also an aid in psychotherapy. Having the patient having this capacity to disassociate from emotional influence at this time, at this moment, so that they can think more clearly, they can remember more clearly, and so forth. Hypnosis has high value clinically. And some of them, I think a very low percentage actually, some of them follow and use and continue to benefit from the phenomena. And then I send them home with the little book, with the homework assignment, read the book and practice this skill of self-hypnosis. We set an appointment, and if they have done their homework, at that second appointment, we just jump in and go to work, because the stage has already been pretty much set. Now, I would like to expose you, all of you, to this little exercise to show you subjectively that maybe what this old guy up here is saying has some validity. If you're open to this, fine. If you're not open to it, ignore me. I want to introduce you to your own extra-conscious abilities here. Well, now, just for convenience, no other reason, I arbitrarily named that extra-conscious intelligence Centrum. That's a German word, means center, core, saves words. So when I refer to Centrum, it's that higher level of ability that you have. And I want to introduce you to that ability in 2 steps. The first step, well, I'm getting a little bit ahead of myself. Let me put this in a more clinical context. Let's assume just for the moment that you are my patient. Well, I said already, mentioned, that my role is to guide your Centrum to do the work of therapy. I have to be able to communicate with your Centrum in order to be able to do that. Well, Centrum hears me, but I can't hear Centrum. It turns out that's your conscious role, is to fill that communication gap. We can do it several ways. But it turns out that the most flexible, time-efficient way is for you to consciously create an image of a chalkboard in your mind's eye. You're not going to see it out here. I'm talking about in your mind's eye. A platform on which Centrum can write and communicate with me. It then becomes your conscious job. Depends on you to be consciously responsible in relaying to me what Centrum writes. Well, Centrum, most of what Centrum will write is evident to you. You know that's true. Commonly, Centrum may well write something that doesn't make sense. It doesn't make sense at all. Don't understand it. And Centrum may well write what you disagree with consciously. Well, this is kind of an unusual thing. Coming from within your own mind, some statement or opinion or whatever form it is that you don't agree with, out of my own mind. What's going on here? Well, I want to give you just a touch of that experience, just to show you, just to provide a little validation of what I'm saying. As I said, 2 steps. First step is this. Let me ask you, all of you, if you want to do this, create an image in your mind's eye of a chalkboard. That's the first step. Just create that image. Now, most people close their eyes, but it's not necessary as long as you have the image. And now I ask Centrum, your Centrum, to verify its presence by writing the word yes, Y-E-S, or however you spell it in Greek, on that chalkboard. I ask Centrum to do that now. Well, I believe most of you, almost all of you, in this room right now have a chalkboard with the word yes written on it. Consciously, however, you may well be thinking something like, yeah, yes is there, but I can imagine any word I want. How do I know that word came from Centrum? Perfectly legitimate question. And at least part of the answer to that question is that when Centrum writes, in all probability, you will not be able to erase it consciously. So, assuming the word yes is still there, I invite you to try to erase it. So, now to the second part of what I want you to experience. I ask that your Centrum erase the word yes and replace it with a different word. Centrum, please select a word and write that word so I don't have to suggest it, so it won't come from consciousness. Centrum, I ask that you write a surprise word, some word that you will not consciously expect. Centrum, please select some word that you will consciously know you didn't consciously think up and write there. Centrum, please write that surprise word now. Okay. Now, most of you, I'm very confident, got a word. Maybe you are satisfied. Maybe you're convinced. No, I really didn't. I don't know where that came. It's just there. Or you may be still suspicious that you consciously put that word there. If you were my patient, in that case, I would simply ask Centrum to erase that word and select some other word that will surprise you consciously. Now, I go through this little exercise just as I have guided you to do. I go through that same exercise with every patient I see. This is all stage setting for the serious work. And then I begin a dialogue with Centrum, posing questions and requests to Centrum for response via the chalkboard. Well, now here is the problem in using this technique. I have to depend on you, my patient, to give me valid, literal reports of what Centrum communicates, as opposed to what you might consciously think Centrum should be communicating. Now, this requires some mental discipline, and some people just have a heck of a time disciplining their own thoughts and actions. Some people seem absolutely compelled to tell me what they think. Well, what they think hasn't changed anything. What they think only gets in the way. I need to know what Centrum communicates. Everything that Centrum communicates, and here's the kicker, only what Centrum communicates. So, you see, the moment, the instant the patient gives me an interpretation or fills in a blank or changes the answer, the moment that happens, therapy stops, wheel spinning begins. With practice, you begin to sense these answers that are actually conscious responses. If you are asking the patient to just literally speak the words, repeat the words, Centrum answers, without bias, without opinion, without interpretation, literally exactly what Centrum writes. Well, if the answer is something yes, or no, or some usually, but not always, usually simplistic response, you're pretty confident. But if the answer is, well, I think da-da-da, no. Patient, I don't want to know what you think. Please restrict your responses to me to the words on the chalkboard. Okay, Centrum. I might start off with this question. Centrum, are you aware of your conscious concern about the migraine headaches? Well, I would expect a simplistic yes or no answer. If I get anything else, I'm very suspicious that I'm getting a conscious response. Patients never actually know, don't understand the cause of the problems they present. They'll never know. Very high percentage have the opinion that they know, and they'll tell you all about it. But when you have identified, when you have uncovered that true cause, they're very consistently surprised. Oh, hey, I never thought of that before. Hey, that's true. That kind of, oh yeah, experience that happens in therapy sometimes. You're engineering that. You're doing that work. You're guiding Centrum to do that work. The patient is doing everything. You can guide this process like a decision tree. You ask one question. If it's yes, you go this way. If it's no, you go this way, and so forth, branching out. Of course, some of these branches get very complicated, and your training and abilities as a clinician are sometimes really challenged. But for a lot of the time, you are functioning like a damn computer without intellectually being involved, as I said, even intellectually aware of what the patient is doing at that higher level of consciousness. Well, the patient usually is, consciously aware of what's going on, but sometimes the patient is not aware. Often the patient doesn't want to be aware. Sometimes patients know they had a bad experience. They were traumatized, abused, whatever. They really don't want to remember. They don't want to know. Well, using this technique, you see, you can guide Centrum to do the work without the patient even being consciously aware of the work being done. Well, I just pushed some more limiting buttons in some of your minds. I'm speaking in rather grandiose terms. Well, here's some more grandiose terms. Look at those success rates. Like I said, this is not data derived from controlled conditions beyond the data coming from patient reports without other bias. I have not been able to afford full-blown research. That's the current undertaking, to generate a series of clinical trials that will satisfy all the scientific minds in terms of control, justifying a truly big study, ultimately. I don't have that to offer. What I have to offer is the evidence that I'm giving you. Well, if that data even resembles accuracy, and you are a psychotherapist, you will recognize this is far and away beyond any other approach to therapy. Far beyond. Now, the chart that I have shown you here is only in the area of physical problems, specifically pain. The top one there, structural, almost always that's the consequence of muscle in spasm. How do we treat muscle in spasm? Well, we treat it with muscle relaxant. Yeah, well, that works. Temporarily. Doesn't solve the problem. It just masks the problem. To fix it, to cure the problem, you gotta get the cause. And I don't know another way that even approaches the effectiveness that subliminal therapy demonstrates in accomplishing that task. Okay. I am through talking and open to questions. Oh, I do want to say one more thing. This nonprofit corporation, this institute that I established, there's the website. If you want to know more about this, that's the place to go. There's a wealth of information about this technique there. I have given you just a sort of a little capsule exposure to it here this afternoon.